Now here I have focused an image of the uterus of 50 years old female. Now what we see is that this is the longitudinal section of the uterus, where this is the myometrium, anterior myometrium, and this echogenic area giving worldly appearance is a fibroid in the intramural or submucosal, you can say. That is, this is a submucosal fibroid, and this is the posterior myometrium, the cervix. This is the urinary bladder in longitudinal section. The fibroid measures 3.7 by 4.3 centimeters. Okay, now you see that it's non-vascular. Where is the endometrial canal? Here, it is pushing the endometrial canal posteriorly. This is the endometrial canal. You see, this is the fibroid, and this is the endometrial canal. As she is in the menopausal age, she does not give any history of menorrhagia, though we see mass effect from this fibroid. This is the fibroid, this area. On the pressure effect is there on the endometrial canal, which is being pushed downwards by this solid echogenic mass, which is the fibroid. Okay, now moving further into the study, otherwise endometrial canal is seen normal. Now when I move the probe towards the right adnexa, and here we see a cystic area with, this is the dependent region pocket of the cyst, and this cyst is multiseptated with echoes. You see, these are the echoes. These are all echoes. This is the fluid within the cyst. There is blood vessel, the supply seen, vessels are seen within it. So vascular, it is vascular, as you can see. And this is the, let me get the true dimension of the cystic mass with echoes. Now this medial and the posterior region shows echoes. These are echoes within the cyst, large cyst in the region of the right adnexa, extending up to the right lower abdominal quadrant. As such, there is no significant vascularity within the cyst. However, the area which is filled with thick echoes shows some vascularity. These are the iliac vessels. So right ovarian mass, complex, cystic, multiseptated, and here is the cyst with a small amount of echogenic material in it as well. This is the echogenic area. This is the septa. This is a thick septa. These are all septas, and you see these. You can see the movement of the debris. This area, if you concentrate on this area, we see a bit movement in this region, and it shows vascularity as well. So this is and here we come across the uterus. This is the fibroid, the endometrial canal, this one, and here we come across the complex cyst, and this cyst measures approximately here we are. Now it approximately measures 8.4 centimeter by 5.6 centimeter, and you can see that these are the septas, thick septa. This is all that. This pocket is filled with thick echoes, whereas this is a septa. This is the outer wall of the cyst, and with it, let me show you the septas once again. Multi-septated. Why I'm saying it? See, these are the thick septas, very thick septas. These are the septas. So multi-septated complex cyst with echoes having vascularity within, and this is the pathology relating to the pelvis of this female. Fibroid and a complex cyst in the region of the right adnexa, extending into the region of right lower quadrant, abdominal quadrant, along with, you see, this is the fluid in the right pleural space. This is the fluid in the right pleural space. This is the liver. This one, what is this? This is the gallbladder, and this thin rim of fluid around the gallbladder is suggestive of ascites. Otherwise, this is not to be considered as pericholecystitis, and this is very commonly seen in patients with ascites. Now you see there are calculi as well within the gallbladder. This is the calculus giving posterior shadow. So the portal vein is normal in size. The blood flow is okay. As far as direction is concerned, the kidney is normal, and you can see the degree of fluid in the right pleural space. This is the right pleural space, and not only that, you see that this vessel, this is the middle hepatic vein. So this is the middle hepatic vein, and it measures approximately 10.7 mm. More than 8 is considered to be dilated, so the hepatic veins are dilated. They give you a bunnish appearance, and this is the IVC, this area, and you can see that the pulsation of the IVC is not normal. She has cardiac issue as well. That should be ruled out by echocardiography. When I go, now this is the left side, passa middle, equal passa. Here on the left side, this is the spleen. Yeah, this is spleen, and this is fluid in the left pleural space. This is the kidney. Kidney is normal. Lung tissue will be seen floating in this pleural effusion, and what's called the hepatization of the lung tissue. This one, this is the lung tissue, this area. So there. So this is our case of the day, which relates to multiple pathologies in a single patient, relating to the primary appears, seems to be in the region of the pelvis. Now this is this cystic area that we're showing you initially, complex cystic mass, and then on the left side as well there is a cystic area. This is the left side, this is the left ovary, and you can see that there is debris again within it. No significant vascularity is seen. So this is a cyst on the left side, left ovarian cyst, cystic mass with internal calcifications and debris, dependent region debris on the left side, left ovary. Septas, this is a septa within the ovary, and this measures approximately 8.0 centimeter by 4.3 centimeter, and this is on the left side. And so this is our case of the day, which is that of multiple pathologies in one given patient with bilateral uterine fibroid with pressure effect on the endometrial canal. Then we saw a right complex cystic mass. Here we are seeing again another cyst relating to the ovary, and this cyst has echoes, septas, tiny calcifications, and measures 8 into 4.3 centimeters. So this is also a complicated cyst in the left region of the left adnexa, and this is our. And then we saw that there is fluid bilateral pleural effusion, and there is dilation of the hepatic veins. We saw that, and this pathology, which is in the pelvis, appears to be of aggressive nature, leading to, and the other pathology, that is the pleural effusion, bilateral pleural effusion, dilated hepatic veins, is due to the cardiac pathology that should be ruled out. Thank you very much.